Hello, I am Lauren with Dear Retirement, and I wanted to spend a few minutes today going over something that we are getting a lot of questions about. Now, we do a Medicare 101 webinar and we do seminars, but sometimes we have other people who are, maybe they've been our under 65 client for a while or walk-ins that we get into the office. And one of the biggest questions we get is this: what's the difference? What are the differences between Medicare supplements and Medicare Advantage plans? People see commercials on TV, they get things in the mail, they can get very confused. So we're gonna break it down today, try to keep it as simple as possible while providing as much information as we can. So Medicare Advantage, you'll hear me refer to that as MAPD. Then we have Medicare supplement on the other side. All I'm gonna do today is just run down this list here, and we're gonna talk about the differences with each type of plan. Number one, coverage. This is a very important one. Medicare Advantage plans are network-based plans. So whether you're in an HMO or a PPO, you do need to make sure that your doctor accepts that plan. And these networks can change on an annual basis. So these are local or regional networks. I will try to write as neat as possible. Local or regional networks, and doctors can choose to not work with a plan the following year. So we do always want to make sure that your doctors are still contracted with that plan when we do our annual reviews. Medicare supplements, on the other hand, these are nationwide coverage plans. They're non-network plans. They don't follow the same network guidelines as the MAPD plans do. You can go to any doctor, any hospital, coast to coast. So if you're traveling, if you have grandkids on the other side of the country, this is the plan you want. It's going to give you that coverage wherever you go. It also covers you outside of the country. So this is nationwide coverage. That's any doctor, any hospital, coast to coast. Washington State, down to Florida, everywhere in between. Referrals. All right, with the Medicare Advantage plan, you do need referrals if you're in an HMO. So HMO, yes. If you're in a PPO, you don't need a referral to see a specialist. With Medicare supplements, you don't need a referral. Okay, so underwriting. Is there underwriting when you sign up for an MAPD plan? No, there isn't. They don't ask you any health questions. There are no health questions on the application. It does not matter if you have any pre-existing conditions. They have to accept you into an MAPD plan. So no underwriting. With a Medicare supplement, this is a two-part answer to this. So when you first get Medicare, you have an open enrollment period to sign up for a Medicare supplement plan. At that point, they don't ask you any health questions. You are accepted and approved immediately. So no underwriting in your open enrollment period. Underwriting is a long word. No underwriting in open enrollment. However, let's say you waited a couple years. You've been in a Medicare Advantage plan. You want to try out a supplement. You're 67, 68 years old. At that point, there is underwriting. There's a series of questions they're going to ask you. They're going to look at your health history, and they also look at your prescription history. So at that point, they can choose whether to approve you or decline you. So after the open enrollment period has passed, yes, there is underwriting. All right, hopefully that is clear for you. Copays. With a Medicare Advantage plan, you do have copays. You're gonna have copays when you go see a doctor, copays for your specialist, co-insurance. You'll have copays if you get admitted to the hospital. So there are costs associated with the Medicare Advantage plan. So yes to copays. Medicare supplement, no. You don't have copays, you don't have co-insurance. You don't have out-of-pocket expenses like that. Plan premiums, these are generally zero or very low. Most of our clients in Medicare Advantage plans are paying nothing. and if they are paying something, it's less than $30 a month. On the Medicare supplement side, there is a monthly premium. I'm gonna give you a ballpark figure here. Again, these are 2023 prices. Ballpark figure for a 65-year-old male in upstate South Carolina would be about $85 to $95. And that is for something called a Plan G. Plan G Medicare supplement, $85 to $95. Prescription coverage, yes, with the Medicare Advantage and prescription drug plans. Now there's something called a Medicare Advantage plan, just MA only. Those don't have prescription drug coverage, but the majority of plans do have that included. It is not included in the Medicare supplement, so you do have to take out a separate Medicare prescription drug plan. Now here's another one that's really important. These are all important, but this one that I'm about to talk about, it's called the maximum out-of-pocket. We call it the MOOP, less words, MOOP, maximum out-of-pocket. With Medicare Advantage plans, the allowable amount for 2023 up to $8,300. I think not every plan has it that high, but that would be the maximum that you would be responsible for in a calendar year if something catastrophic happened, up to $8,300. Medicare Supplement Plan G, your maximum out-of-pocket would be $226. That's it, $226. After you meet that deductible, everything else is covered for you. All your doctor's visits, if you had to go to the hospital, any testing, x-rays, imaging, scans, anything like that, that's covered after that deductible. So this is the difference in a nutshell in a quick little video. Two of the biggest things to remember are coverage, network-based, supplements are non-network based. Let me write that over here. No network. Nationwide coverage, any doctor, any hospital. You can go anywhere. Remember, is the copays and the maximum out of pocket. So you do have copays with the Medicare Advantage plan. You do have a maximum out of pocket, so there is a cap on it. Medicare supplement, no copays. Maximum out of pocket with the Plan G is only $226. So I hope that answered some of your questions and cleared up some of maybe what you were wondering about, the differences between the Medicare Advantage and the Medicare supplement. If you do have more questions, you can give us a call. Our office number is 1-800-615-1440. And you can find us on all the social media platforms. We're at Dear Retirement. You can also click on the link below for more information. And like I said, we do webinars for these, or seminars, to where we go into this a little more in depth. We would love to have you join us. It's free. You can sign up and watch from the comfort of your home. Have a great day.